all can be masters of our health.
Thank you, Dr. Ahmed. Thank you very much. And on the other side, we get the engineer winner, DJ Little, aka the Moses. I go allow for make your own personal introduction. As you always can say, Kushe Kabo, you know, thinking come just shots. Over to you, DJ Little.
Hold on a second. Greetings and salutations, me family them, me people them. Una kushe, una kabo. We tell una thank you. Finally, the sun don't come on in London. So you will buy your tickets and go Portugal. We all don't be 1 year. And then when you come, you get for spend another 10 days now. You don't get for spend another 10 days. So I get 10 days money advance ahead of you. Well, kushe, kabo. This topic today, now very, very important topic to me, especially, and because all to the can talk about today, nothing we all get for relate to. So una stay tuned, listeners, and una do what una can always do for we. Una pass on this message to others. So share. Again, I want to say welcome to Dr. Ahmed Kamara on this new month, and thank you so much for your patience, and thank you for taking your time out to share your knowledge on Diaspora Voices, and we're truly grateful.
Thank you, DJ Little. Thank you. Listeners, viewers, if you're watching us, all you need to do, just share the program. And if you want to call and engage on this program tonight, you're more than welcome. We'll put the number out there. You can call and then just engage. If you've got questions for Dr. Ahmed, listen, feel free to contact Dr. Ahmed. Feel free to ask Dr. Ahmed on the show tonight. Dr. Ahmed will be willing to answer your questions. So just waiting, talk about earlier on. We're talking about mental health. And tonight, Dr. Ahmed will break down for we into two sections. Where the first one are depression, and then the second one are the PTSD, when are the post-traumatic stress, where it's very common in our community. Sometimes you not only where you see people there, you see somebody well dressed and all that. I mean, if you check, probably is up there's something wrong, but they behave normal compared to people back home, wherein we then talk about, say, oh, this person sick, mentally deranged and all that stuff, then they say I'm reckless, dirty and all that stuff, then they, whilst here the case different, you see people holding their bags, going to offices and all that, and they still work, but mentally there's something wrong, you know. So tonight, Dr. Ahmed will take an opportunity for actually breaking down for we, for can talk about for can educate we. Okay, you know, if you stay in denial, this is real. So Dr. Ahmed, coming back to you, you give me a two broad topic tonight where on the flyer, a lot of people in the one that say, hang on, this is very interesting and all that. So why this topic tonight?
Yeah, so thank you very much. I mean, mental health is a very, very widespread condition. It's a large umbrella that covers a lot of things. So there's a lot of things that where they cover. But I wanted to really just keep the focus on the most common mental health conditions that a lot of people will in the community would have either experienced for a short period of time, you know, several months perhaps. Some people have experienced it for years and years, or you know somebody, or you know someone who's experienced it. And depression is one of those common mental health disorders. The other one is anxiety, but that's not on the list today. Its management is quite similar to depression, but we're going to focus on depression. And then PTSD, post-traumatic stress disorder. And I really wanted to talk about PTSD, you know, in light of what's happened, you know, what's been happening with the COVID situation. You know, we normally tend to hear about PTSD amongst soldiers, people who served in the army because of traumatic experience they may have had. But PTSD is also quite common amongst non-veterans, amongst, you know, what we call ordinary people, because of, you know, traumatic experience that they may have had in other areas of their life. So really, really important conditions. And look, if we get a chance, because mental health is quite closely linked with domestic violence, we may talk a little bit about that as well. But that's you know, we'll see how we'll interwove them all together.
Oh, thank you, Dr. Akme. Thank you very much. And now we are going to the topic, as Dr. Akme done breaking down for a little bit. Now we are going to the real topic for tonight. First and foremost, Dr. Ahmed, because listeners them, viewers them, a lot of we they use their words here, oh, are stressed, are depressed, but sometimes we actually not even know waiting at the meaning, and we not even know the signs of waiting we talk about. So please, can you just educate us on this one? What are the signs that we need to look out for?
Yeah, very good point. Now look, we all would have experienced, you know, sadness at some point in our lives, or would have felt low in terms of our energy, our mood, and would say, you know, I'm stressed, I'm depressed. But you know, but you're able to carry on with your normal day-to-day activities. You're still able to go to work. You're still able to drop your kids off at school. You're still able to go and pay your bills, do your shopping, and it probably might last for a few days, maybe a couple of weeks, and then you know, you're feeling back to normal. Or you've got the support of friends and family, and so things still carry on in your life. So you know, we all experience a lot of those. What clinical depression is a persistent level of sadness that impacts on the way you feel and you think for a significant length of time. And from a clinical point of view, you usually have the cutoff of at least 4 weeks, and you know, where it's impacting your life for at least 4 weeks. Usually it's more than that, where you're not really able to function well. You know, you're lacking motivation. You know, you're not able to experience you know, pleasure, so something we call anhedonia. You know, so let's say you're a Chelsea football supporter, right? You're sitting there, Chelsea wins the Champions League, and you're still just sad. You know, you're looking at the TV, your friends are there saying, yes, Chelsea has just won. They beat Man City, but you're still just sad. I mean, that's an example of not being able to experience pleasure. You know, your son or daughter comes home having done well at school. Mommy, daddy, look at what I've done. Look at the certificate, and you're just, you know, you're neutral. You know, you don't smile, you don't laugh, you're not able to enjoy the moment with them. So this is clinical depression, and it has other impacts, you know. So there's this prolonged sadness, not able to experience pleasure, and lacking motivation. But you also get impact on your sleep. Often it's insomnia, so a lack of sleep. Although some people with depression will get excessive sleep, where they're sleeping for more than 12 hours a day. You know, reduced energy levels, so you just feel tired all the time, and you know, it can also impact on your appetite. Now, it can make you lose appetite completely, or make you eat excessively. We call it comfort feeding in healthcare. And so you can, you know, as a result of depression, some people lose a lot of weight, whereas others might gain a lot of weight. So it's a whole constellation of symptoms, and you know, but the key thing, I think, for the general public is, if you're feeling really sad, not yourself, lacking motivation, and if people around you are starting to mention it, asking you, what's wrong, you're not your normal self, and they're asking you a lot, then that's a sign for you to maybe go and seek some advice. But if, you know what, because it's an illness where you might not even be aware of it, you might not even be aware of your symptoms, but if you're the loved one or the friend, you know, the partner of someone who's experiencing or exhibiting these symptoms, then try to encourage them to talk about it, try to encourage them to seek help, to speak to their GP, or, you know, try and just get them to open up a bit, and we can talk about support, how you can support someone, a loved one or friend who might be experiencing depression as we go down the line. So that is clinical depression. It really impacts on your life, and it stops you from doing what we call your activities of daily living. You know, think about everything that you will do when you get up in the morning. You know, put on your clothes, have a shower, eat, go to work, you know, do some shopping, pick up kids, drop kids off, come back home. You're not able to do any of that. You know, so you're not even able to bathe. You're not able to have a shower on a regular basis. So you see how it impacts you. You know, your kids start turning up to school really late. because you're just not able to get yourself up to drop them off, or you're turning up late to work yourself, and you can't explain, why, what's going on. It becomes a problem at work. But it's not just one symptom, it's a constellation of symptoms.
Wow. I think you've done justice on that. Listeners, as Dr2YOU, from the doctor himself, I don't give you all the clues, the points them on like guidelines on what we talk about. Dr. Ahmed, just quickly, based on what you've just said there, how can this be treated? Is there any cure for that?
Yeah, so there is very good, effective treatment. And, in medicine, it's always best to start with a least invasive treatment. So the treatment even starts before, can even start before you see a medical practitioner. So, for example, we know that exercise. So we'll come back to exercise. I know we talk about exercise on this show quite a lot. Exercise for mild to moderate depression, exercise is as effective as taking an antidepressant for mild to moderate depression, okay? So you can significantly improve your mental health by taking regular exercise. So that's really, really important. Listening to positive things. And if you are someone who knows a loved one or friend who's experiencing depression, being supportive to them, talking about positive things, trying to get them to do the things that they used to enjoy. For example, they enjoyed going to a concert, they enjoyed listening to particular types of music, or you might have some positive development tips. But let's move on. You either you're not able to do any of those and you present to your GP, or you're doing all of those and things are still not improving. Then there are additional things. So they're therapies. So they're psychological therapy. And again, this is non-prescribed, it's not medication. And this includes things like, from a basic level, like counseling, talking to someone who's a professional about things in the current and in the past that may be impacting your mood, and they'll teach you strategies on how to deal with those things. It's not about forgetting about them, because you can't erase your past, but you can change your perspective on them and how you deal with them, and that will have an impact on your mood. And then they have more detailed types of psychological therapy, like CBT, cognitive behavioral therapy, and other more in-depth ones that the psychologist will talk to you about, depending on how you're responding to those initial ones. Now, if the exercise still carries on, yeah, you still try and do those things, because if you're doing that and you're doing psychological therapy, you're gonna make a significant improvement. Where if that's not helping, or if you present with quite severe depression, then you may need to start prescribed medication also. And there are various types of medications. We don't need to go into the different types here, but they're all sort of, the key ones are under an umbrella term called SSRI, selective serotonin reuptake inhibitors, and there are others as well. But I mean, that's at a level where you've spoken to a medical professional, either your GP or psychiatrist or mental health specialist nurse. They've made a diagnosis and you've decided together that you're going to need medication as well. But making the diagnosis is also part of the treatment, because there are lots of other things that will present and mimic depression. Okay, so there isn't a test for depression. We ask lots of questions, like I mentioned earlier, and then we reach a diagnosis. But we do tests, sometimes we do blood tests to exclude medical causes that can mimic depression. So for example, thyroid problems, or you may have a problem with your sodium level or your calcium level. So underactive thyroid can mimic depression. Abnormal sodium, potassium, and other biochemical markers can mimic depression. Sometimes it's a brain tumor, for example, that changes someone's personality. So you go through a lot of these things, and then you rule out those medical causes that I've just mentioned, and you say, well, this is clinical depression, before you start the treatment. And then there are cases of, where, well, what do you do when you're doing all of that? You're doing the exercise, if you can, you're eating well, you're getting on top of your sleep, you're doing psychological therapy, and you're taking antidepressants. You're still not improving. What do you do then? There's something we call treatment-resistant depression, which, maybe we'll get a chance to talk about that.
Thank you, Dr. Ahmed. In saying all that, Dr. Ahmed, okay, where would you actually, if you have to put a percentage on the male and female population, who suffers most on depression?
It's a very, very good question. Now, at least in the UK, there's a prevalence of about 5% of the population on average experience depression. And women, more women experience depression than men. So for every 2 women with depression, you have 1 man with depression. So the ratio is 2 to 1. 2 women to 1 man. That's the ratio. So more women experience depression than men.
Wow, okay. So again, it's easy, Dr. Ahmed, for people to go into depression mood, i.e. probably too many bills, relationship, and maybe looking for a child, or looking for maybe the boyfriend or the husband left or the wife left and all that. So there's a whole lot of, this is a huge topic you're talking about tonight here. So how can we mitigate this kind of things not to happen?
I mean, you just touched on something really, really, really important there. I mean, these are what we call, stressors, and they're significant risk factors for depression. And I mean, how do you mitigate? Well, you try and, not allow those things to get out of hand, so you try and, so that you stay on top of your bills. But if you've already developed depression, one of the help and assistance that you may benefit from through your psychologist, or we have what we call social prescribers nowadays. So it's not medicinal, not a drug prescription, but they assist you with other life issues. So getting on top of your bills. Some people, so it becomes a vicious cycle. So they may have struggled to pay their bill. They get stressed, and then that puts them into depression, or they get depressed for some other reason, and then because of the lack of motivation, energy, and impact on daily activities, they're no longer able to do the things they should be doing, like paying the bills, even though the money is there to pay the bills. It becomes very difficult to manage those sort of things, and so then they'll need help to get into a routine of paying those things. So they'll need to find what is the root cause here, so they can be assisted. The relationship problems, some people might be experiencing domestic violence. I mentioned this at the top of the show. Now we know that the most victims of domestic violence, vast majority, are women, and it's intimate partner domestic violence. But we know that men experience domestic violence also in heterosexual relationships, right? Domestic violence from their female partners sometimes, but you also have male victims of domestic violence in homosexual relationships, or women in homosexual relationships. So it's not just the woman in a heterosexual relationship. So it's finding out what's going on, and there are various support agencies out there that you can then be directed to help with those various areas. But so it's really unpicking and trying to tackle all those various factors. Now, with the immigrant population, a lot of people, especially when they first come to this country, but maybe even years and years down the line, they're struggling with immigration. That is a significant cause of of mental health problems, because they're constantly under the threat of having to leave the country. A lot of them don't even have a registered general practitioner, so they're stressed even because of that. They're worried about becoming unwell and needing to go to hospital and being either refused treatment or being asked to pay huge sums of money out of their pockets, which invariably they cannot afford. So I mean, this factors, the stressors are just plenty. You lose a loved one. Again, that's another issue. If you don't have the support in place, you don't have supportive family members, friends, to deal with the grief, then that can lead you into depression as well. So it's a lot of things. I mean, there are women who are going through menopause. There are women who are pregnant. You have, mental health problems, depression around the time of giving birth or just after giving birth. We call postnatal depression. So a multitude of factors. That's why I smiled when you mentioned all of those things. Seems like you've researched this topic extremely well, DJ.
Thank you, Dr. Ahmed. And I think for now, I want to bring Dale in so that at least he can contribute towards the show as well. Because I know he gets one tweet in the windsurf one ad, and I don't just want to sit on the driving seat like he's sitting there as if he's the passenger behind. But I can see he's got one or two things that he actually wants to contribute towards the show. Over to you, DJ Litu.
Dr. Ahmed.
Yes, DJ Litu.
How can I top up what he's been doing? He's doing excellent. And like you said, he's gone home the last 4 weeks when we created the topic, and with all the guidelines and the criteria you put through, the man has done his homework. But what do you expect? They usually it takes a madman to know a madman. So that's really up his street, you know what I mean, right? So this guy's a madman who's done his own research about his own people, and he knows what he's doing. But really, Ish, well done. You put your questions eloquently. I really don't, I'm really just following up. So literally, I don't want to deviate from what you're talking about now on depression and all of that stuff. But I will talk more on when it comes to mental health and coronavirus. And that's where I want to get involved, because I'm really, really looking forward to getting my teeth into those questions. But Ish, I'll let you carry on. But I want to say thank you, and I can see quite a lot of engagement. I just need to encourage our viewers, and if they're watching the program, like Ish said, please feel free to engage on the program. Send your comments, send your questions on the comment box. We'll ask Dr. Ahmed, or he will be able to pick it up live, and good engagement. And yeah, it's going well. I want to see where we're going to take this this conversation to.
Thank you. Dr. Ahmed, thank you again for a brilliant topic tonight. But I've got 2-in-1 question as you link them. How is depression different from stress?
Yeah, it's a very good question. So we get stress by various factors. It may be difficulty at work, difficulty with bills, difficulty in our relationship, or loved one going through a terrible time. But the difference is usually stress is short lasting. Okay, it may last a couple of days. It may last maybe a few weeks. But also people who are experiencing stress often are able to carry on. They're able to carry on doing their activities of daily living. Okay, so they're still able to go to work. It's stressful, but they're still able to go to work. It's stressful, but they're still able to drop their kids off. It's stressful, but they're still able to do their shopping. Whereas with clinical depression, again, stress can lead to depression. So it's a lot of those similar factors, or sometimes it's not even obvious what the trigger is. But you start to, you lose motivation. You are not able to experience pleasure, anhedonia. You're not able to, to then do your activities of daily living. So that is a key difference, where it impacts on your daily activities, and it lasts at least 4 weeks. So that is the difference between stress and depression.
Oh, thank you. Right. One more question, and then we can move to the next topic. So, how tell us about suicide and depression in mental health, Dr. Ahmed.
Yeah, I'm really glad you asked that question. Now, look, you see, with any mental health disorder, that is one of the sort of the things that we don't want to result because of a mental health condition that someone might be experiencing. Now, you often don't get someone going from never talking about suicide to actually committing suicide. It's usually there are episodes of self-harming, yeah, where it may be physically cutting themselves, it may be even stabbing themselves, it may be inflicting pain or harm to themselves in one way or another, taking an overdose of medication. So and often it's not because they want to take their lives away, it's because they're crying for help. Okay, things have become so difficult, they don't know what to do, they don't know who to turn to, and so by harming themselves, it immediately brings them to the attention of authorities, and they get some help that way. But then you have, for people who've committed self-harming, 10% of those people over the next 10 years will actually commit suicide. Yeah, so 10% over 10 years of those who've committed self-harm. So there's still a significant, number of people who commit suicide without actually having self-harm in the past, and that's a dangerous one because there are no telltale signs beforehand, and so you have no way of preparing for this. And what we tend to see is that you tend to get a lot of women, more than men, self-harming or attempting suicide, but not quite completing it. They weren't actually planning to commit suicide. They just wanted to get help. But with men, when a man attempts suicide, they usually complete it. So we're worried about anyone who may have tendencies towards suicide, especially a man. Usually when a man says, look, I'm going to take my life away, they usually end up taking their life away. There's usually no second chance to talk to them and try and help them out. Now, so depression or any mental health disorder in particular, we're always worried about suicide risk, and it's a very important part of the screening questions that we ask patients. And I think if you're going through depression, post-traumatic stress disorder, or any mental health condition, and you're presenting to your GP health practitioner for assistance, for help, or you go to a hospital accident and emergency, it can be a bit shocking when someone asks you, now, tell me, have you ever thought of doing anything bad to yourself? And then eventually they may actually come out plain, and you should, make it quite clear. Have you actually ever thought of taking your own life away? Killing yourself. Have you ever thought of doing that? And you get various responses. Now, if you've never been in that position as a patient before, it can be quite shocking. It can even maybe push you back, go into your shell and stop engaging, but don't. I'm saying if you get asked this question, don't be put off. It's not because of you. Some people are like, oh, why are you asking me this question? It's nothing to do with you. It's just the health practitioner is just trying to make sure that they look after you in the best possible way. So don't be put off by it. That's the first thing. And if you are actually thinking about it, and sometimes it can get so overwhelming, the thoughts can get so overwhelming, you don't know who to turn to, where to go, and you might just end up doing something, even if it was a cry for help, you might end up doing something so drastic that it unfortunately terminates your life. So if you get to that point, reach out to someone. It may be a friend, a family member, a loved one. If you have no one that you trust enough to open up to, call NHS 111, call 999. You can do an online search for the Samaritans in the UK. You can turn up to any hospital accident and emergency department. If your GP surgery is open, if it's during opening hours, you can call and say, look, I need to speak to the duty doctor. I'm feeling really, really unwell, and I'm sadly thinking of taking my own life away. Receptionists will help you. Even during this time of COVID, people think, you can't get appointments. It's wrong. You can't get appointments with your GP. Absolutely not the case. I'm seeing patients who need to be seen all the time, and I'm talking to patients every single 5 to 10 minutes all the time, and we can help you. So, it's important that you get help. you know, because we don't want you to end your life. You know, we can help support you and get you out of the depression, the severe depression that you might be going through. And when you're well, you can actually, you know, most people look back and say, look, thank you. I'm really, really grateful that when I needed help, there was someone there to help and support me, so that I didn't take my life away, so that I didn't leave my children behind, my loved ones behind.
Thank you, Dr. Ahmed. During the past years or month and all that, I'm sure you've seen people who we actually don't they do a self-harm to themselves, and then after talking them out of it, and then maybe therapy, treatment, words of encouragement, and then few months or few weeks along the line or few days along the line, then they do them again to themselves, harm themselves again. Yeah. So how do you actually help those people that keep going back and forth, back and forth?
Yeah, now look, the thing is, there's always support. That's the first thing, and it's not you. It's your underlying, you know, mental ill health that, you know, that's leading you to present in that way. It's like someone who has asthma, who gets breathless to the point where they need oxygen or they need emergency treatment. They need an ambulance. They need to go to A&E. You know, it happened 2 weeks ago. It's happening again today, and most likely it might happen in the next 2 to 3 weeks. You treat them, right? When they present, you still give them the option, give them the treatment, you give them the advice. They may have a chest infection, we treat them. So look, likewise, you have mental health. You know, you're unwell, you've got depression or any other mental health, and as a result of your mental health, it's causing you to present with, you know, self-harming or even attempted suicide. It's not your fault, it's your underlying condition. And so we'll treat you, we'll talk to you and try and get to the root of the problem. You know, what are the supportive factors? So, you know, we'll look at patients holistically. So what are the positive things? What's going on well in your life? Okay, have you got plans for the future? You know, work, employment, career, education. Have you got loved ones? Have you got children? You know, if you were thinking of committing suicide, why didn't you complete it? You know, was it because you didn't want to leave your children or your parents or your loved one, your partner in a state of loss? And you know, for them to go through that grief, if you had actually come, you know, so we ask a lot of questions, and then we also look at, well, what's not going well? What are the concomitant factors? You know, is there excessive use of alcohol, excessive use of drugs, okay, illicit drugs, for example, cocaine, for example, ecstasy, you know, is there domestic violence? You know, sometimes this is someone trying to cry for help, okay, so they're crying for help, and that's how they might be presenting. You know, often in the case of domestic violence, the partner, the person, the victim doesn't just come out and say, "Hi, doctor, I'm going through domestic violence." It's usually something else. And they've got to build a trust, because often domestic violence is, you know, you're almost sort of telling on someone who a lot of the time you still love. You know, you're intricately in a relationship with, and you love this person, but they're inflicting harm on you to the point where that harm can actually lead to loss of your life. And so it's really difficult for patients to just come out and say, "I'm experiencing domestic violence." Patients are worried, well, what's if they've got children? Ooh, what's going to happen to my kids? Is social services going to take them away because I've said I'm experiencing domestic violence? Or even, you know, just saying I'm depressed. People are worried. No, that's not how it works. This is about helping you. The best person to look after, you know, your children is you, the parents. And so you'll be given as much support as possible to do that in the best way possible. So, you know, coming back to the question, repeated presentation with self-harm or attempted suicide, we go through all of these questions. Look at what's going well, what's not going well, how can we support you, what support mechanisms can be put in place, you know, what wasn't done the last time you presented that can now be done, you know, can we get psychological therapy? You know, there are home treatments in there, people who can support you in the community. You know, you have health and well-being hubs where, you know, perhaps you're going through financial difficulties, they can assist you with that. We have social prescribers, as I mentioned earlier. So there isn't one size fits all. It all depends on what's going on in your individual circumstance.
Thank you, Dr. Ahmed, for that explanation. Well, viewers, listeners, if you're watching us, just share the program. Feel free to send your comments. Feel free to call or ask questions. Dr. Ahmed is here. Dr2YOU is here to actually help with whatever question, whatever you want to know. Dr. Ahmed is here. Now, Dr. Ahmed, we're moving to the second stage of the program now, right? Briefly, I just want you to tell the audience, our listeners, our followers, what is the meaning of PTS, right? Post-traumatic stress disorder. What is the meaning of that?
Yeah. So really, you know, PTSD, the meaning is in that definition that you just gave, post-traumatic stress disorder. So this is a disorder that happens after a very traumatic, dangerous, often hurtful episode in your life, in one's life. And that's why at the top of the show I mentioned it's often associated with veterans, so people who've served in the army, because of what they may have seen at the front line, you know, what as a result of their job they may have done, you know, it's combative, you know, they may have seen their colleagues being killed, been shot, they themselves might have been shot, or it may have been just even hearing sort of the sounds of shelling, of guns, of bombs. And so PTSD is quite a significant health problem amongst veterans. But it also happens amongst non-veterans. Let's take Sierra Leone, for example, during the Civil War in the 90s, what people saw, okay? Or people who've experienced war in any part of the world, just ordinary civilians, what they saw, you know, the maiming, the amputation, you know, the rape, may have been a victim of rape, some people themselves. Or let's move away from that sort of scenario. What about people who get chased and bitten by a dog, okay? And they become extremely fearful of dogs. So they see a dog and all of a sudden they get severely stressed, okay? So this is not just I'm stressed, but I'm okay, I can still go out. They get severely stressed as a result of replaying the events, the traumatic episode. So somehow something triggers that event that may have happened months, years, or decades ago, but it triggers the event, and then they start to replay that event in their mind, and they feel almost as they did or worse when the event originally happened. So let's say you got chased and bitten by a dog 10 years ago. Now you see a dog that's, you know, 100 meters away. It's not even coming towards you, but it triggers you to replay that episode when you got bitten by that dog. And, you know, you start to feel really stressed, anxious, you know, fight or flight, all of these sort of stressful responses. You might be sweaty, you might feel your heart racing away, palpitation, you know, getting this feeling of impending doom as if you're going to die. So this is post-traumatic stress disorder. And it, again, with any mental health disorder, it's when it's so significant that it impacts on your activities of daily living. So it stops you from doing what you should be doing. So it stops you from now even leaving the house, okay, being able to drop your kids off at school. Or it means you've got to get up 3 hours early just to psych yourself up to leave that front door, to go and buy a pint of milk in the morning and come back home. And so you can see what impact that's having on you. It means you're not going to sleep well because you've got to get up so early. And what if you forget? Oh, you know, well, it wasn't just milk, and I also needed to get some bread, and so you got to go out a second time. So it takes you another 3 hours before you can go out as well. So this is post-traumatic stress disorder, and in making the diagnosis, what we tend to see is that patients start to exhibit what we call avoidance behaviors. Okay, so you start avoiding anything that will trigger that event. Okay, so let's say, you know, there's a movie coming on TV now. You know, it's a drama movie and people are shooting in that movie, or it's a movie where there are dogs barking. You know, or you know, if I come out of my house and I turn left, there's always a dog 5 doors down the road that barks, and that makes me fearful. So I'm never going to walk down that side of the road. I'm always going to walk and turn right when I come out of my house. So yeah, so this is post-traumatic stress disorder. It's a big deal. It's a big deal, and it can significantly impact on your daily activities and on your health.
Thank you, Dr. Ahmed. And again, you've just you've elaborated on what is the meaning of that, how the side effects. So how can this be treated, and how long does it last for?
It's a really good question. It can last weeks, months. For some people, actually, it can last a lifetime. It can last their whole life. And it's about managing and coping with it. It's just like how someone might have high blood pressure or hypertension, and it's with them for the rest of their life, but they've got to manage it. Okay, so it doesn't become so detrimental to their day-to-day activities, so they can still function. But they're giving strategies. They may need to take medication, but they give alongside any strategies that they may get from a form of counseling, CBT, or any other psychological therapy that they may have to undergo. So the length can be quite variable, but it's about how you manage it on a day-to-day basis, so that it doesn't stop you in your track. And it also comes down to exercise features again. If you're exercising, we say healthy body, healthy mind. Okay, so if you're keeping fit, keeping exercising, and you're eating healthy as well, okay, it will impact your mental health positively. And it's also what you do with your mind. Are you feeding yourself, your mind? Are you feeding your mind fruits of positivity? So you're reading or listening to positive things on a daily basis. But some patients might have coexisting mental health conditions. Whether it's depression or whether it's something else like called delusions or psychosis or schizophrenia. All of that will need to be addressed in order to adequately deal with the problem. So it's a multitude of things, and medication is not usually the first thing that we go to, but medication can be one of those treatment options also.
Thank you, Dr. Ahmed. Right, I've got I need to do something here, so I'm going to ask you this question. For women who just actually had a baby, let's say a newborn baby, and then they have another two children at the age of, let's say, 3 years, 2 years, and a newborn baby, right? Because we keep hearing this, na postnatal depression, maybe, i.e., the baby don't sleep at night, and the husband is not there to give her the support midnight or maybe during the day to help her with the other kids. So she's got 3 load in her hands to battle with. So is that easy for this kind of women to actually go into that kind of depression?
Yes, absolutely. So, if you don't have adequate social support, okay, your risk of developing mental health of any sort is going to be significantly higher. Now, you described a very, very difficult situation there. So this new mom already has 2 other children, aged 2 and 3, and there's a newborn, either about to arrive or just arrived, okay? And they're having to take care of that newborn, who's, as you mentioned, not sleeping well at night, as most newborns, they tend to just stay up at night. And their partner, their husband, isn't there. Because maybe they've got to go to work, for example, or it may be an unfortunate situation where they are there at night, but they're just not particularly supportive. Now, one woman might experience this as a stressful time in their life, but they're still able to function well, and that might just be because of their attitude, towards it, their resilience. Okay, towards dealing with something like this, or maybe they have adequate social sort of support. Maybe during the day, they have a family member who helps. Some cultures you'll get maybe their mother or the husband's mom will come and stay over for a period of time. And it's not even just some cultures. I mean, just It's just something that is available to some people, you know, nothing to do with culture. You know, if there's a grandparent who's got the time, maybe perhaps they're retired or they've taken some time off work, they can come and stay, and that helps. So add on to that as well, financial stress. So you're having to deal with all of these things, and then there's financial stress, and then there's housing difficulty. You're probably, let's say you're staying in a one-bedroom, not even a flat, but you're just in a one-bedroom shared accommodation scenario. It gets even much more difficult, plus financial stress, looking after 2 young babies and a newborn. And so you can see how someone can just really, you know, it can be extremely difficult for someone to cope in those particular scenarios. And they'll develop, you know, postnatal depression. Again, there's support there. You know, don't suffer in silence. Pick up the phone, speak to your GP. If you're stressed, call NHS 111 and speak to someone and get some help. Yeah.
Thank you very much, Dr. Ahmed. I'll now bring in DJ Little to actually contribute towards the show, because I can see he's busy just listening, and I want to give him the opportunity to actually ask some few questions. Over to you, DJ Little.
Unmute. You're on mute, DJ Little.
DJ Little, on mute, please.
VS, it a lie. He catch me at a sleep. So I'm going to confess now. That's the reason why I don't like DJ Ish anymore. He catch me at a sleep. That's the reason why. And then, so don't pretend about you're trying to bring me in. I've already told Dr. Ahmed where I went. I am absolutely stoned out. I don't understand. It's Monday morning. Ladies and gentlemen, I don't want to take the floor, but Dr. Ahmed, I'm telling you something. I'm having feedback on my, yeah. It's been a mad day today at work. I've got to be honest. Like, we've got so much outbreaks, and I don't want to go into specifics. We've had a ward that has had nearly 10-month outbreak of something else where we thought we were getting on top of it. So I was at work 7:30 this morning, and I didn't leave work till about 6:15. So you could excuse me, but I am engaged, even though I'm dozing off. You're going to pay for this, you know that? Yes, you're going to pay for this big time. But I will ask a question, because you talked about the PTSD, you talked about the military, you've spoken about women who's just had babies and all of that stuff. And it's interesting to see. But what I want to find out is, unlike depression, PTSD has a cause, so to speak. So, for example, somebody who's experienced something that is actually not being able to deal with the sort of like the coping mechanism. So you talked about the PTSD from the effects of the Syrian war and all of that stuff. Do you think it's something that from somebody that might appear normal, which Ish mentioned earlier, that can look and is not able to engage? How do you manifest to say this person is actually a PTSD patient or is going through PTSD, so to speak? How are you able to equate the same thing and saying, well, they may not be depressed, but this person is having or is showing symptoms of PTSD?
Yeah, it's an excellent question, DJ Little. It's, you know, and this is where medicine becomes a bit of an art. So there is, okay, this is what all those lists of terms that DJ Ish and I went through, what someone with PTSD might be experiencing. But often they don't come up to you, and it's not so clear that this is exactly what's been going on. And it's investigation, it's building trust with the person, and it's also, you know, building that courage in yourself as a clinician to ask searching questions. You know, when did you start to feel this way? Did something happen on such and such point in your life when you started to feel this way? And sometimes they may not be comfortable, even, you know, to a doctor behind closed doors, no one else listening, they may not be comfortable to reveal that on the first, second, or even third consultation. Imagine someone's, the cause of someone's PTSD, let's say it's a rape, okay? You know, sadly, you know, been raped in the past. And whenever they see anyone that remotely resembles the perpetrator of that rape, it brings everything back and they get anxious. It stops them from doing what they should be doing. It's extremely difficult, you know, so they've got to build that trust with you in order to be able to actually say that this is what it is. You know, and sometimes, you know, we hear about the term, especially in the context of domestic violence, you know, abuse from your actual legal partner, like sexual abuse. Now that can be very, very difficult to talk about, because some people feel really embarrassed. I mean, how can I accuse my husband, or how can I accuse my partner, because it doesn't always have to be a husband, of sexually abusing me when they're my legal partner? So yeah, it's unearthing these things, and eventually something will give way. It may not be with the first consultation. It may not be with that first doctor. It may not even be with the GP. It may be that eventually things get so bad, so overwhelming that they present to accident and emergency, or they do something and present to the police, or they do something, social workers get involved, and they break down. And they just start pouring their hearts out and say, look, this is what happened. This is what happened. This is what's been going on all this while. And when you make the diagnosis, when that revelation comes, you can start to then treat the actual problem. So, you know, we may have been treating it as depression, so we don't always get it right. Or we may have been treating someone as having personality disorder, when actually what was going on was PTSD. So yeah, really, really, really good question. And that's why, you know, it's, I think, you know, don't feel pressured. I mean, when you go and speak to someone, you know, just go and talk. Just go and talk. You know, you don't have to say everything. You know, go and test the water, see how comfortable you are with that clinician. And I can speak for GP surgeries. You know, often there are more than one GPs in a surgery. For women, if it's an all-male GP surgery, you have practice nurses that work in a surgery. Perhaps it might be more comfortable for you to talk to the practice nurse about how you feel. Okay, you might find that a lot easier, and maybe that might be a way for you to break into the topic, and then it can be discussed with the doctor subsequently. Very, very challenging at times to make a correct diagnosis.
Yeah, DJ, is one more question from me. And Dr. Ahmed, thank you for that response. And I just feel like with everything that's even dealing with the first topic, which was depression, I feel obviously with your knowledge and expertise, I don't know whether we're actually going to do justice within 90 minutes to such a topic, because mental health is it's like walking through the Atlantic Ocean or the Amazon forest. Like everything, every day you will discover new things, new ways, new times, you know what I mean, symptoms of mental health and all of that stuff. However, you're just trying to give us a general overview of what mental health is, so that we can understand the telltale signs, so to speak. But I look at our community, and I think we have a community largely which suffers greatly for mental health, in terms of in social media, in our daily lives, in our personal activities. How long do you think post-traumatic stress disorder lasts for people that suffers, and can it be cured? So like when you look at somebody and then you're thinking, oh, she is definitely suffering from PTSD, can it be cured? Can you say, okay, maybe this person look like, say, they don't get up for the last 8-9 years of their life, and then let's try and see, let's start a talking therapy, or let's go for medication?
Yeah, good question. I mean, it certainly can be managed well, and it, on occasion, can be cured, but it's very difficult to erase a past event. But what someone can be taught is how to deal with those emotions. So there are various things. I mean, as you mentioned, the length of this show will, I mean, even if we had a whole day, it won't be enough to cover all of these topics properly. You have some people who, you have doctors who specialize on just depression. That's all they do, they talk about. So you can imagine how much in depth you can go into any of these topics. So there's something called...
Sorry.
Yeah, I get that.
You got the joke. I think Ish missed the joke.
No comment.
Yeah, so there's something called desensitization and therapy. So let's say, for example, you get your post-traumatic stress disorder because of a fear of even crossing the road, because maybe when you were very young, you saw someone being hit by a car. So it doesn't even have to be you yourself that's experienced the hurt or the trauma, but you perhaps witnessed hurt, and so you're just really paranoid about crossing the road. And so you can imagine, if there's no overhead, no bridge, right? Or let's say it's a long road, there isn't a traffic light. It means for maybe a 2-minute journey to the shop might take you 20 minutes, half an hour, because you've got to walk all the way to where there's a zebra crossing traffic light, which is the safest way to do it. But you can imagine what impact it would have in that. So they have this thing called desensitization therapy, where your psychologist will take you they will simulate the event that caused your trauma, or that causes the traumatic experience that you get each time. And they might, for a start, they might just show you on a computer screen or on TV, someone crossing the road. So you're not there, you're sitting in a room, and they'll show you and they say, look, how do you feel? And they'll talk you through how to cope with your symptoms, your anxiety, your palpitations, your feeling sweaty. And then when you get confident enough, they'll probably then take you and say, well, look, let's just go and stand by the road. We're not going to cross. Let's just stand by the road. We're not going to cross, and see how you feel. And you can watch other people crossing. And then next time they'll say, well, let's take you to where you actually cross, somewhere safe. You're not going to cross. You're just going to stand as if you're going to cross there, and you watch cars coming and going. And then next time they'll say, well, now let's cross the road together. Okay. And if you get through that, next time they'll say, now you cross the road by yourself. Okay. And again, you get through that, they'll say, you cross the road by yourself and cross over again, because you need to come over again, etc. So that's desensitization therapy. So depending on what what the trigger for your PTSD is, there are various therapies that can be used, and they'll teach you coping mechanisms to deal with it, so it doesn't become a debilitating condition for you. So you might still get a bit anxious, but you'll still end up going out and doing what you need to do, so you're not so that you can be functioning. Yeah, so it's a tricky one when to say, yes, it definitely can be cured, because there's always that potential that if something goes wrong, it comes all over again. It comes up again, and you revert and go into your shell, and it becomes very difficult. But this is like any condition, and mental health is no different. Some people, let's say, I don't know, they may have high blood pressure, and they're very good at taking their medication. For some reason, they stop, or their diet changes, start having lots of salts, they stop exercising, and things get out of hand, right? So we go over things again and try and get you back to where you were. Same thing can happen with mental health conditions.
Right, fantastic. I'm just going to move on with one last. I think I got put in my place rightfully by Andrew Curtis. Andrew, thank you for putting me in my place. He says, please, DJ Little, don't undervalue such important discussion by your silly jokes, which is rightfully. And Andrew, I have to be fair to you. You're absolutely right. I'm not trying to downplay the importance or the significance of such topic, but it's good for you to. We've also got comments coming from Andrew. Says mental health is a major issue amongst our community in the UK, especially within relationships between partners, which you touched on earlier. He added and said, the sad truth is that quite often victims don't want to access help. What advice would you provide on how one could recognize they may be having mental health issues? That's something to hold on to for later So it says, what advice would you provide on how one could recognize they may be having mental health issues? And then the second statement is coming from Auntie Susan Banyaleg. She says treatment must be holistic. She said treatment must be holistic, involving their careers of family members, since they live with or know the person's normal experience to any strange changes. And she went on to say, thank you, Dr. Ahmed, for a great overview. There was also a question which came about anxiety and depression earlier on, but I've lost that through my communication trail. So I don't know if you want to respond now, or Ish could move on to asking.
No, I think let Ahmed respond on to that, and then we move on to the other questions.
Yeah, thank you very much for all of those points raised, questions asked. I think I'll start with the first one from Mr. Andrew Curtis. Yeah, I mean, recognizing mental health, that either you may be experiencing mental health issues or a loved one may be experiencing mental health issues. I think it's really important, because we're all partners in this. It shouldn't have to wait until it gets to the point where it's so severe that it's so obvious, because often then it becomes major depression, and you want to catch it early, so you can put in place interventions that may not even require the need for medication. So we mentioned earlier, so with depression, for example, someone might be experiencing a lot of sadness, but it's not just temporary sadness, but it's persistent sadness over long periods of time. And for clinical depression, we're talking about at least 4 weeks, impacting your life for at least 4 weeks. And it's lacking energy, lacking motivation. Okay, so if you have someone who, or it may be, let's say if I was someone who every morning I'll get up, be full of life, vitality, I'll go for a run and, be looking forward to going to work. But I'm just not feeling that anymore, I sleep for 9-10 hours. So I'm getting more than the recommended hours of sleep, but I don't feel refreshed. I don't feel energetic. I'm not looking forward to going to work. We call it anhedonia. So not experiencing pleasure. I mentioned the example of, a Chelsea supporter who Chelsea's won the Champions League, should be really, really happy, but they're just not happy. It doesn't get them excited at all. But there are other subtle signs that people might not even might not necessarily associate with depression. So lacking sleep, excessive alcohol, and sometimes the depression is causing them to lose sleep or develop insomnia, and they drink alcohol in order to get them to sleep. But alcohol is not an antidepressant, okay? And it doesn't allow you to get into good quality sleep, what we call deep REM, rapid eye movement stage of sleep. And if you're not, they have various stages of sleep. If you're not getting into REM sleep, you're not going to get a good quality of sleep. So it just almost sort of comatoses you, but without giving you the quality of sleep. And in fact, alcohol is a depressant, okay? So it makes you feel more depressed the following day. So lack of sleep and appetite, so change in appetite. Some people might start eating excessively and put on a lot of unhealthy weight, or they might just not feel hungry at all because of their mood, because of the lacking energy motivation. That might be what's stopping them from being able to prepare food for themselves to eat. So there's a constellation of symptoms. And worryingly, some people might even start to have really, really morbid thoughts. Okay, so thoughts of self-harm, thoughts of suicide, and you start to get worried when it's not just thoughts, but it's also making plans. If someone starts researching online, but how do I harm myself? How do I take my life away? Okay, that's very worrying. Someone stockpiling medications to take an overdose, that gets worried. So there are lots of different signs. Now, sometimes it might be quite tricky for you to recognize it in yourself, because that's just the way mental health is at times. But if friends, relatives, or if you're starting to have difficulties at work or meeting your tasks, meeting deadlines, meeting your commitments, it might be a sign, it might be an opportunity for you to step back and say, what's going on? Why am I not able to do what I used to be able to do at once upon a time? And seek some advice. Just go and have a general chat with your GP. We welcome that. It's, it's not always, it doesn't always have to be an obvious thing. I'm coughing up phlegm or I've got a chest pain. It may just be that, doc, I'm not really sure what's going on, but this is what's been going on. And you say exactly from your own point of view, and then you can get an objective assessment of what may have been going on. So very, very good question, Andrew. So, if you recognize it in a loved one or in yourself, seek advice through your general practitioner. And if there are ever any signs of, self-harming, suicide, someone, really having morbid thoughts, not wanting to be alive, not wanting to be here, definitely seek advice. And if it means calling 999, NHS 111, going to accident and emergency, you must do that. You must, because you're worth more than that. I mean, it's often a temporary, momentary, period of your life where you can take drastic action that unfortunately can be permanent, irreversible, because when you take your life, you're gone and there's nothing we can do to bring you back. So seek advice and you can get support. Now, I think it was Susan Banya-Legg who mentioned about treating patients holistically. And this is absolutely really, really vital. It's really, really important. It's not one size fits all. And as I mentioned earlier, it's not always running to the antidepressant medication. What else can be done in terms of supporting you at home in your network? Okay, so there's lots of things we can talk about here. So some people might be part of religious groups. Okay, might be you belong to a church, a mosque, or any other religious groups, and that might be somewhere really useful for you to get some advice. Okay, always important. I mean, it's really, really important to be part of a community. It doesn't have to be something really big, but belonging somewhere, so you can get that support that you so vitally need. It might be, even getting the family members involved, okay? Again, with the person's consent, because the patient has got to be comfortable for their health, their details of their health to be discussed openly with even their partner, even their children. They have to give consent for that to happen. I mean, there are only times where things are so drastic that their lives or the health or lives of others are at risk. That's when sometimes confidentiality might be breached. If their life is at risk or others' lives or health at risk. And, it's a whole different topic going into things like Mental Health Act and sectioning people, etc. But yeah, it's really important to be holistic and find out about the person. What do they like? I remember a patient of mine who, he was depressed. He had been on 3-4 different antidepressants, okay? And I got to know him, I got to talk to him. He was, he in the first couple of consultations would hardly say a word to me. It was a very difficult consultation. It would be a one-way, I mean, imagine you were just asking all of those questions today and I wasn't saying anything. I mean, it'd be very difficult for you to carry on the shows. And that's how it was, but I persevered. And I was always asking different things. And one day I touched on boxing. I think it was Anthony Joshua. He was doing quite well. And I just mentioned, oh, did you hear about boxing? And his face lit up and he was smiling. And then he started telling me about Muhammad Ali, all of those boxers from time. And I thought, wow, this guy likes boxing. So we started talking about boxing. So I knew, what to focus the conversation around before going into anything about, and I got him to open up and we got him some services that were useful, that he found useful. So yeah, it's not one size fits all. And the holistic care is really, really important. Anxiety and depression, they're often, overlapping. Often someone with anxiety has an element of depression, or someone with depression has an element of anxiety, but you can have pure states of anxiety. And this is, a significant level of anxiousness. Let's say someone, is an actress or has to give a public speech, stand in front of people, we call it stage fright. So they get so anxious, or, they're in a meeting at work and has to sort of speak out. They get so anxious that they don't, they start getting palpitations, they start feeling sweaty. Some people might even wet themselves, or get an urge to rush off to the bathroom because of diarrhea. But it can become, so again, mental health problem is not just being a little bit stressed, it's when it becomes so significant that it's impacting on your activities of daily living. Okay, so you're getting so stressed that you're not able to perform at work. Sometimes some people get really stressed and they're not even able to put their finger on it. What is it that's causing me to be stressed? But I'm so stressed, I'm scared to go out. And you ask and ask, and they themselves don't know. Okay, so general anxiety disorder, they're just really anxious. And forgive me, not stressed, they're just really anxious about being in any scenario, at work, on the bus, going out. They can't put a finger on it. And it stops them from even going to the shops, taking their kids to school, going to work. Really, really impact on their health. But there are lots of, there are lots and lots of things that we'll go through in a consultation. Is there alcohol, drug involvement? These are all other added factors that can lead to stress and anxiety. So really, really good question. I'm glad you asked them. But I think the bottom line is here. If you think you've got if you think you're stressed, if that's how you describe it, if you think you're a little bit sad or depressed, or you're just sad for too long, if you think you're grieving the loss of a loved one, okay? Now, we all grieve. I think it's normal, it's natural to feel upset and sad when you lose a loved one, but it's when it goes on for months and months and there's no sign of it sort of ending. We're not saying forget about your loved one, but it's stopped you. Now you can't go back to work. You're so sad, you're so, lacking energy, motivation, and it's impacting your life. It's changed you completely. Then it becomes quite worrying, okay? And then rather than just grief, it may well actually be severe mental health disorder, depression, that needs, formal support, formal diagnosis and support. So really, really good questions. And I hope, they're long answers, and that's because it isn't, as I mentioned, one size fits all. So I hope I've done them some justice, but thanks for asking the questions.
Thank you, Dr. Ahmed. Thank you. At least I think today you've done more talking than ever before, engaging with the audience and all that. I like that. I like that. Thank you. Well, viewers, if you're actually watching us, you're following us, just share, just put your comments, ask questions, things that you want to know. Just ask questions. Dr. Ahmed is here to answer those questions. Why? Dr. Ahmed, because of time, I think you've got topics that you need to touch on again, because 90 minutes will not do justice to these topics, and people are asking for more. But before we go further, before we finish the show, we've been talking about all this adults. We don't talk about the kids. We don't talk about the kids at all, because for the whole of last year, we've been on lockdown. We see our kids, they've been home, not doing anything. They've been into they go into this depression, into so many things that we've never seen our kids in that way. So please, I just want to ask this question, Dr. Ahmed. Do children react differently from PTSD than adults?
Thank you so much for asking that question. It is a very important question, and absolutely, it's, in fact, mental health in general, not necessarily present in the same way amongst children, and that's because kids are kids, and they'll respond to things in a different way, and the presentation can often, to the inexperienced clinician, can be quite baffling. So a child with, depression or post-traumatic stress disorder, the sign might just be a change in their personality, okay? Or it may be that they've gone through bedwetting and they've been dry, okay? And they're absolutely fine, and then all of a sudden they start bedwetting again. Or they start wetting themselves during the day at school, or, defecating on themselves. Or they start just sort of, we call frozen watchfulness, okay? Especially when perhaps the trigger of their PTSD or the perpetrator of what might be causing their mental health disorder is around them. So let's say they're with a particular member of the family, they might just freeze and not be their usual vibrant, active selves. they may at that stage just almost go into their shell and become a different person all of a sudden. And then once that person moves away, they light up again, or they're very happy Monday to Friday and on weekends because perhaps they're going to stay with another relative, especially if both parents are not together. Things change. Or it's the other way, that they're very sad during the week, and on the weekend, because of where they're going to be staying, they're extremely happy. It's almost as if it's a completely different child. Some children might be self-harming. Now, a lot of kids are, they're very, very internet savvy, technology savvy, at times even better than us adults. So it's engaging them and finding out, well, has anything happened online? Has there been any online bullying, any incidents with your friends, colleagues, or internet trolls online? And trying to come down and speak the language of the child, so that they can trust you and open up to you. We don't always have the time in general practice, which can make it quite challenging. But when we suspect that a child might have an underlying mental health problem, we refer to relevant, pediatric colleagues, children and adolescent mental health services, CAMS services, or community pediatricians. And they will have sometimes an hour or 2 hours with the child, and they will go through, get the child really comfortable. At times, they might just give the child a piece of paper, so they draw. That's how some children might express themselves. And through those drawings, they can actually explain, what it is that they're experiencing, what is going on. So the symptoms, absolutely, very, very good question, DJ. The symptoms in a child can be quite significantly different from that in an adult. But it's important to be aware of it, so we can give them the support that they need, and try and get them to then go on and be the very best that they can be, because it is a very important period of any human being's life, childhood, adolescent. And if they can't be the best that they can be because of undiagnosed, unsupported mental health disorder, it's going to have a long-lasting impact on the rest of their lives.
Thank you very much. Thank you, Dr. Ahmed.
You're welcome.
Right, one more last question so that we can round up. Based on all the symptoms, the signs that you've outlined here, some people who have those symptoms and then don't show anything, but other people might have those symptoms and then get worse. Why is that, Dr. Ahmed?
Yeah, I mean, and this is the interesting thing. I mean, it's always our genetics interacting with our environment. Okay, so this is an interesting statistics. Now, there isn't a gene for depression, for example, but what we know that if you have a family member who's had depression, you have a 10 to 20% chance of developing depression in your lifetime, and so that shows that there are some genes, something in your genetics that makes you more predisposed to depression. And if there's studies which we call twin studies, okay, where if you look at identical twins, if your twin partner has depression, then your chance of developing depression yourself is 50%. Yeah, you have a 50% lifetime risk of developing depression. So again, now, as an identical twin, you share a lot more genes than just someone who is a member of your family. So you can see where we've gone from 20% to a 50% lifetime risk. So there are genetic factors. So now let's come back to your question. Why would two people experiencing the same stressors, I think that's what you were referring to, like same life stressors, but one person develops depression and another person doesn't develop depression, right? And it's, and that's one of the explanations. It's, there are genes interplaying with the environment, and it may also be to do with other subtle things now that makes someone a lot more resilient than another person. So what support mechanisms do they have in place? Do they have a supportive partner, supportive brother, sister, supportive parents? What else happened in their childhood? okay, that primes them. You know, what we get programmed in our childhood, right? So if you, for example, you know, if you every time you fell, your parents rushed up to you, they're very emotional, and you know, you and compared to another kid who, when they fell, parents went there and spoke to them nicely, but they didn't necessarily make a big deal out of it. So you get this thing called expressed emotions, okay? Or you're in a household, growing up in a household where parents are arguing all the time, and this is what you've got used to. So your response to certain triggers is going to be quite different. So it's a complex interplay of genes and environment and social support network that determines whether, you know, you develop clinical depression as a result of particular stressors, or not, or maybe just a very stressful period in your life that you can hopefully, you know, overcome. The truth is, you just never know. When you're going through a stressful period, you don't know who's going to lead to who's going to develop clinical depression at the end. And so if you've got a friend, a family member who's going through a really stressful situation, the best thing you can do is support them. You know, support them and protect their confidentiality. If they confide in you that this is what they're going through, you know, don't start sharing it, you know, on Facebook, on WhatsApp. You know, start sharing their, you know, personal problems with, you know, with others that they haven't given consent to. They trusted you with their very personal information, and you keep it private, because that's ultimately what you'd want them to do for you. If you were in that situation yourself. I think that is the best thing we can all do for anyone who we feel needs support, is reach out to them, support them. And when someone starts opening to you, I always say, look, there are people that I speak to outside of my hat as a GP who are just friends, family members outside of the surgery, and they start opening up, and I make it a point and I say, look, be rest assured, what you're saying to me is strictly confidential. Now, I'm friends with you and X, Y, and Z. Doesn't mean that because you're telling me, I'm going to share it with X, Y, and Z. This is strictly between me and you. And that gives them confidence. And you keep to your word as well. Yeah.
Thank you very much, Dr. Thank you. Well, viewers, listeners, you have the opportunity. Dr. Ahmed is here. Dr. Ahmed, before I actually bring DJ Little, can you just explain again? Because people, for any time you come on the air, people see something different behind your screen. So can you just explain to people again the benefits or the reason for you doing this?
Yes, I mean, look, this show, the benefits of this is purely to give back to the community, purely to give back, you know, something that I've been privileged to have learned and studied, because I really believe that, you know, we should all take control of our own health. We should all become masters of our health. And I don't mind, you know, if everyone becomes so good at looking after themselves to the extent where they put me out of a job, I'll be really happy. Then I would have succeeded. You know, I'm sure I'll be blessed. I'll be blessed with other things to go and do. But look, honestly, it makes life a lot easier.
Sorry, Dr. Ahmed. So the Dr2YOU, just obviously you always have that logo. People want to know more.
Oh yes. Yeah. So no. Yeah. Dr2YOU is a private online consultation service that's been set up over the last year. We're going through a CQC care quality sort of a certification at the moment. But the whole aim with this is so that if you need a doctor's service, you need to speak to a trusted somebody, you know, someone who can listen to you with quality, put you first as a patient, and work with you in partnership. So all of those signs you can see behind me: patient first, quality care, empathy, collaborative care. You can contact us at Dr2YOU. You can book an online appointment with us, and it's a video consultation. So it's not just on the phone where you don't know who you're talking to. It's a video consultation service. Where we can do so much on telephone now, you know, people who've experienced through their GP, but we can do even more through a video consultation, because I can see you and you can point to your body parts. Even if you don't know the name of the body parts, you know, let's say you're experiencing the pain somewhere, but you can point to me and say, that's where the pain is, okay? Or that's the hand, it's this ear. And you may even have things like a blood pressure machine at home. So you can take the reading in front of me or whichever clinician you speak to, and we can work through lots of different things. We do blood tests with everything you'd get from a GP service, but it's done privately, super quick service and turnaround, blood test results, within the same day. Very, very efficient. And the whole point is taking the doctor to you. So wherever you are, okay, we'll come to you, your living room, your bedroom, that's where you want to be. It might be your office. Not whilst you're driving though. You've got to be safe. But that's the whole purpose of Dr2YOU.
Thank you very much. Thank you, Dr. Ahmed. Why, before I actually bring DJ Little to just wrap up the show, DJ Little, do we have any comments on the chat box for Dr. Ahmed to just respond quickly before you wrap up, please? Unmute, sir.
Thank you very much. It sounds as if like one of those conferences where people are always telling you, unmute. There's been various comments coming through, and I'm just going to bring myself up on screen along with yourself. Okay, can you see me now? Yeah.
Yeah.
So the comments has come. There's been a lot of engagement from Auntie Susan Banya. Like on the timeline, she's really been engaged on this program. So it'd be good to hear her thoughts afterwards. And also Donald Kamara. This session is complex, though it appears to be. Thank you, Dr. Ahmed, Dr. Kamara, for breaking things down for most of us. You are thorough with your explanations. I find that I don't have to ask questions. He went on to say, I don't have to ask questions just for the sake of asking questions. But special thanks to Dr. Kamara for understanding and answering even questions that have not been asked properly. It is always a pleasure listening to you, because not only are you always on top of your subject matter, you have a particular mystery and of your human frailties as patients. Oh, that's nice. Thank you. And thanks also due to,
thank you.
To your presenters as well. So that's definitely somebody. Thank you very much, Donald. And I think it's been like really one of those things where either DJ Ish or myself could have just come here and said, look, Dr. Ahmed, just talk about mental health and focus on depression and PTSD, and we don't ask any questions, and you would have made it just simple and bite-sized. And I think that's what's been engaging within the last months that since you've chose Diaspora Voices to share your knowledge, and we are grateful for that. And it's quite clear that you simplify it, you made it bite-sized, and if you ever think like the whole GP thing is stressing you and you want to go into teaching, please feel free. The students will enjoy you. They will enjoy you as a teacher. So if you ever think about it, just say to your wife, you're looking at taking a 90% pay cut because you won't get that much money as a teacher. But the stress level will be amplified. And then, but what you will give back is the knowledge that you will pass on to generations to come. And I think
thank you so much. Thank you.
And we haven't even touched on the COVID. We haven't even touched on domestic violence. As you said, there are so many things that we could discuss here tonight, but literally let's leave it for another day. There is a lot to go through, and because mental health is current, mental health, the whole of the government across the pond, the UK and I, they're trying to raise mental health awareness. They're trying to encourage people not to be within themselves and to sit and not share their pains and their woes. And I'm sure as GP, day in, day out, whether through the phone call, through the Dr2YOU, you're getting those contacts that are coming. And my worry is that every one of us, every 80+ million people in the UK will be diagnosed of some form of mental health. I know I have been. I know DJ is definitely been. You know what I mean? He's on pills. And you understand? So, but on a much more serious note, we just need to like not sit alone and go through certain things which we've been used to doing. We need to share knowledge. We need to share our thoughts. We need to speak to somebody, even take the first step, even before going into, for example, before going to your professional, your GP or your nurse practitioner specialist. Get somebody that you can confide in. And we have this sort of common theme, which we say, oh, Saloma, when you talk about boy, go talk about your business. However, everybody talks about everybody. But if you know that you want help, you share with somebody that you trust. If they decide to break that trust and share it to somebody else maliciously, then it's up to them. But at least you're seeking consultation, you're seeking help, because they may be able to signpost you. So if you're going for the signposting, reach out to somebody. So for me personally, I would love us to carry on with this theme of mental health, because it's prevalent within the UK. And I hope that maybe next month we can look at another aspect of mental health and see how best we can put it out there to the community as well. And also, if you're somebody that knows one who has gone through some form of mental health and wants to get them to get help, go to Dr2YOU, contact Dr. Ahmed, and get yourself professional guidance and advice. The numbers are out there, the email is out there. You can go onto Facebook and you can reach out to Dr. Ahmed personally and then say, look, I've got my son, my daughter, my brother, my husband, my wife, and so on, and start that first point of conversation. I want to thank everybody that has been engaged with us and here that's made the program worthwhile tonight. And I want to thank DJ for doing an incredible job tonight. And also thank you once again, Dr. Ahmed. And we hope to have you again next month. Let's continue with this, please. I would like to, if you don't mind.
Yes, absolutely. Thank you so much. No, I think we should certainly we should leave next month if we can for domestic violence and COVID and mental health in the context of COVID. You know, that's something so that we can wrap it up quite nicely. Yeah.
All right, thank you very much, Dr. Ahmed. Do you have anything to say to the audience before you go?
Well, look, just stay safe, guys. Look, we're all getting excited. It's June 21st soon. We don't know whether all restrictions are going to be lifted. Well, let's just continue doing what we're doing, you know, washing our hands, keeping the social distancing. And when you're called for your vaccine, your COVID vaccine, go for it. You know, go and get your vaccine. You know, we've heard about the Delta, you know, the Delta variant, so the one that was originally discovered in India. We don't want to call it the Indian variant. We actually don't know if it originally started in India. That's just where it was first discovered. We know that the vaccines are effective against them, okay? And we also know it spreads. The transmission rate is 40%, at least 40% more than the other viruses. So look, don't be pessimistic though. Don't think, well, why take the vaccine if we're still going to have to be social distancing, you know, wearing face masks. It's just a way of managing things, but we're getting closer to just doing things as normal. We don't, you know, hopefully we don't want to go back into a massive lockdown. You know, I want everyone to be healthy. So let's keep looking after ourselves, for ourselves, but also so we can look after each other.
Thank you. Viewers, listeners, we just want to say thank you for actually contributing tonight, for engaging with us. We hope to see you again next Monday with our own program when we'll bring something to you guys. Thank you very much. DJ Little, over to you, sir.
Thank you. Well done, people. We're off here now. Oh, well done.
Yes,
Thank you very much.
Well done, guys. What a topic. I think I didn't realize we'll be able to talk about it in this way, you know.
No, this is the longest I've seen Dr. Ahmed engage and talk. Like it was just the things are just coming out. Like he enjoyed the topic.
This is the thing. It's mental health. You know, it's quite hard. It's quite hard to just come out with these points. Well, these are the symptoms. You got to break it down. So yeah, I think when I break it down, it makes me understand it a bit easier as well, because my brain is not that fast. I've got to break it down into into really simple bits and pieces.
Like,
Well, thank you very much, guys.
Yeah, but the thing is, the whole of this mental health thing, it's such a way that you and I that are presenting normal, most of us that are actually having genuine mental health issues. But for some reason, there is a trigger point which we've not been able to trigger to go into that collapse or that relapse, to compare yourself with somebody who can be classified as mentally ill. But there are men in suits, women in blouse, walking up and down every day in the office, and I'm sure you see that every day. And they are all suffering from mental health, and you just have to see, for some of our very active socialites in the community, they definitely display mental health issues, but who's there to call that for them?
Yeah, absolutely. It's so easy to disguise, and you know, and we're all putting up appearances, you know, and no one is everyone can be a victim of this. I mean, from even us as doctors, you know, I mean, suicide rates is in fact amongst GPs have one of the highest suicide rates. You know, the first is the anesthetist, because they have the drugs to put you to sleep, because you know they know exactly if they take something, that's it, they're not waking up again. But it's, you know, we're all going through so much stress.
Thank you, Dr. Akme. Thank you very, very much for tonight. Thank you.
Well, thank you so much. DJ Little, before you go, just quickly, you know, I've been sending you one message for say KDA, then they plan for they want to do something like a online Zoom. Oh, okay.
No, just stop the recording, the official recording. Yes, go on.
Okay, some online Zoom something that, you know, party for their members then.
Yeah.
So I will tell them, say I will reach out to you for that, find out more.
Oh yes.
They're a little bit, you know, they're not necessarily very technical. You know, they're not used to that face-to-face something, so it's a completely different experience for them.
Okay.
And they wait on me desperately for get back to them.
Now, who's dates? When are the dates?
Well, waiting and be want is like go back to them with some sort of an idea of, well, waiting this will be involved in terms of one, cost, timing, you know, because if I know
the dates, then I definitely will be able to do it. In terms of like, for example, Namiga for do the DJing, Namiga for do I need to know what's in the theme. I can help them plan it, and based on, if you get somebody for call me, catch me when they can, and then definitely if you say this,
well, Nami them put before. So what do you do tomorrow evening?
Tomorrow evening.
When are the best time for call you?
Okay, tomorrow evening will be fine. Say after 8 o'clock.
Okay.
Yeah, that will be okay.
Okay, I will do that.
The stuff I've been sending you for Avril, I've been for Avril in Big Sister, then diagnose her for breast cancer. And even just want a second.
What's the situation now? You okay for talk about her now, or you want to call you?
Yeah, if you can, because she's really, really up on me back on that. Say if I don't talk to you, you understand. So like because they want go Ghana, they talk about doing a mastectomy straight away because I find they don't go.
Yeah, no, I see the scan, and the scan very suspicious. And they say for correlating with the symptoms, and I suspect say if you don't notice something, we make you go do the scan also, not so just random scan.
Yes. No, he said if they feel pain in breast for a few some time and everything and all of that stuff. Because now one part the woman them like she's okay, she's financially okay. A man now be the what they call the chief executive now airport in the previous government. You understand? So they okay. So she's able to provide a good medical facility for checking. If you're able to go do that, you understand? And if you just want a second opinion as to what is going on, so that you go able to understand.
Yeah, I mean it it looked very suspicious. All the features of waiting as what you go see in somebody where go get features of breast cancer.
Yeah.
When I mentioned that speculated appearance.
Yeah.
And I waste time.
Yes.
Like time.
I think that they worry am most because in fact say then tell and say it's gone far and they need to do it immediately, the surgery immediately as a matter of urgency, you understand? But in Ghana then they go do the procedure, you understand? So it don't get.
I mean with the scan, with the ultrasound scan where it gets itself, it not enough for know how far it don't go. What you gonna need where it go Ghana, let it go under like a breast care team, and Ghana they're very good actually. They're gonna need for do more detailed scan, maybe a CT scan for check the lymph glands them under the armpit, and then for check all the organs them, because then they will determine exactly how far it don't actually go. And if it just did at the breast, that's very good. Then say a mastectomy is going to be very, very effective. Now this part of the world in England, after a mastectomy, they can still want to do even sometimes radiotherapy as well.
Yeah.
Or combine them with chemotherapy. Then